They've just gone back to school, and now the challenge is keeping them there. It's not a silver bullet, say the UK's chief medical officers, but after 18 months of disrupted education, they're recommending vaccinations for healthy senior school students.
Our view was the benefit exceeded the risk to a sufficient degree that we are recommending to our ministers in all 4 nations that they make a universal offer, and I want to stress the word offer, of vaccination to children 12 to 15, in addition to the ones that have already been given it.
Earlier this month, though, the Joint Committee on Vaccination and Immunisation said while the health benefits of vaccinating 12 to 15-year-olds outweighed the risk, it was marginal, so they would not recommend it. The chief medical officers say their decision has looked at a wider impact on children, speaking to a wider group of experts, including mental health.
They all made the same point, which is the disruption in education that has happened over the last period since March 2020 has been extraordinarily difficult for children and had a big impact on health, mental health and long-term public health, and that this is most apparent in areas of deprivation. They were very clear on that. So the question for the CMOs on the educational side was, will vaccination reduce the disruption and therefore reduce these very significant negative impacts? And our assessment is the answer to that is yes.
What's being offered is a single dose of the Pfizer jab, and both parent and child will have to consent.
I'd be happy for my daughter to have it, and I also work in a school as well, so I know what the disruption it has and the effect on mental health and education.
I am father of a 12-year-old, but I'm really, really wary about the reasoning behind this, and I'm a bit scared that we might be being recommended to give her a jab that'll do her harm and that there'll be very little benefit from her. My mind's not made up, but I'm very, very wary.
For schools, the tempered realism. It won't be the end, but a reduction in educational disruption. But new data today revealed the staggering success of the vaccination programme, reducing the gravest of outcomes. Between January and July, more than 51,000 people died with COVID in England. Only 640 of them have been double jabbed. That's just 1.25%. Some of those may already have had COVID before their second vaccination. Just 256 people were infected more than 2 weeks after their second jab. That's just 0.5%. And of those 256 who died, 13% were immunocompromised, and more than 75% were clinically extremely vulnerable. The Prime Minister on campaign promotion duty today. The slogan, after the jabs, the jobs. He wouldn't be pushed on the jobs policy detail, but on jabs, he was clear.
You know, the vast majority of people who are suffering seriously from COVID are unvaccinated. Very sadly, people who are still succumbing to COVID, dying from COVID, are the unvaccinated. So please go and get your jab.
It will now be up to ministers in the 4 UK nations to decide whether to accept today's recommendation, a decision the European Medical Agency made back in May. If agreed, around 3 million children could be eligible for the jab, and countless potential lost school days saved.
Well, let's talk now to Dr. Mike Tildesley, the epidemiologist who's a member of the government advisory group SPI-M, which provides infectious disease modelling evidence to SAGE. He also advises the government on the transmission of COVID-19 in schools. Dr. Mike Tildesley, should parents place more weight in the JCVI's recommendation or the Chief Medical Officer's recommendation?
Well, I mean, this is really difficult. Now, we do need to remember that the recommendation brought by JCVI was really based upon health benefits from taking the vaccine. And this is based upon 2 things. So the first thing we need to consider is, of course, that children who get infected with COVID, in the vast majority of cases, they will only have mild disease. And there was some concern through JCVI of a very, very rare side effects of the vaccinations. Now, again, I hasten to add this occurs in a very extremely small minority of cases, but because the risk associated with COVID in children is so low, this is why the JCVI did not recommend vaccinations for children purely based upon health grounds. Now, what the chief medical officers have done is they've looked at wider impacts and looked at the likelihood of, if there are outbreaks in schools, potentially schools having to close and children missing education because of that, and weighing all of those things up. That's why they have recommended vaccination for 12 to 15-year-olds.
So where does that leave parents? Because isn't there a recipe for confusion there, and that will risk denting uptake, won't it?
Well, I think that does leave parents in a very difficult position. I think the key thing, though, that should be really pointed out is that the risks from getting infected with COVID and the risks of taking the vaccine are extremely low for children. So, of course, children and the parents must make those decisions themselves based upon weighing the risks up. But the risks associated with the vaccinations for children are extremely low.
What would you do for your children?
Well, I mean, very interestingly, I have an 11-year-old, so my child doesn't quite, my oldest child doesn't quite get into that bracket. But of course, it would be a discussion, of course, with my children's mum, and we would make the decision based upon that. I would always be in favour of vaccination if there is a clear benefit, but I think it's a very, very difficult decision for parents to have to make.
So you're in a quandary like many other parents, or would be if your child were old enough. But I mean, I just wonder whether the chief medical officers have any business in recommending a medical intervention to avert educational disruption. Is there any precedent for that?
Well, I'm certainly not aware of precedent, but of course, if you are putting in a control policy, then you always try to put in a control policy that not only considers direct health impacts, but also considers other impacts. And in a sense, we see this with lockdowns. If you only thought about health and you didn't care about any impact to the economy and people's mental health and well-being, the optimal policy during a pandemic would be you stay in lockdown until you've eradicated the virus. But of course, you can't do that, because by doing that, businesses go bankrupt, people lose an awful lot of money, and of course, mental health and well-being is severely damaged. So with any policy, you always need to look at all of these other factors when trying to make a decision. Well,
Chris Whitty said that they were only considering the benefits for children, albeit wider benefits than just health. But isn't there a sort of sleight of hand here that, just as with the flu vaccine, there is a consideration of a benefit to wider society, and that really is what's at stake here?
Well, there is always going to be an indirect benefit, of course, because if you don't have outbreaks circulating in schools, then that reduces the likelihood of parents getting infected, and then, of course, that's spilling over into the wider community. But I certainly think there is integrity in the fact that really we do not want a situation where schools have to close. We see that education has been significantly impacted in the last 18 months through school closures. And of course, you may argue that, at the height of the various waves of infection we've seen so far, that might have been a necessary measure in order to bring things under control. But of course, school closures are extremely harmful in the long term. And so we do need to consider vaccination on those grounds to potentially reduce the risk. And I think that's why they have a very difficult job trying to recommend the right policy.
Reduce the risk, but it's not going to eliminate it entirely. There is still a risk, is there, despite this extended rollout of schools closing?
Well, the problem is there is always a risk. The vaccines are extremely good, but of course they're not 100% effective. So even if we had every single person in the population vaccinated, then there is always some risk. Potentially, we could get more transmissible variants coming along. We could have variants that evade the vaccine a little bit more. But of course, the more people that you vaccinate, that risk reduces.
If we see this wave picking up speed, as is feared, and pressures on the NHS with flu season approaching and so on, is there an argument to mandate vaccine of children to make sure schools stay open and to prevent the risk to wider society?
Well, I think this is very much more political rather than epidemiological discussion as to whether you should mandate vaccines or not. I think, we haven't mandated vaccines for adults. It's always been down to personal choice. And what we've done is try to encourage people to take up the vaccines. So, I think clearly we need to do what we can to get as many people vaccinated as possible. And actually, I would say beyond children, there's still work to be done to get vaccines out to, say, younger adults, because uptake has been lower with younger adults. So I think there is certainly an argument there. And as we move into the autumn, I think it's really, really key to monitor what's going to happen to cases and hospital admissions, so that if necessary, more work can be done to try and get as many people vaccinated as possible.
And just briefly, do you fear there is still a real risk of the NHS being overwhelmed this winter?
Well, I think we do need to remember that the NHS always comes under pressure, even in a non-COVID year, and respiratory viruses do spread much more in the autumn. I think we monitor hospital admissions, but we don't want a situation like we had last year. And I think that's very, very key, that we need to monitor that data over the next month so that we can provide advice to the government so they can make the right decisions to try to mitigate that risk.
Dr. Mike Tildesley, thanks very much for joining us. Fatima.